We've got a clinical case. Okay, let's go. 65-year-old woman, is brought to your clinic, my beloveds, by her daughter due to a 3-month history of slowing down. The daughter knows her mother has developed a shuffling gait, difficulty initiating movement, and her tremor that is most noticeable when her hands are resting in her lap. And a tremor, not shaking, that is most noticeable when her hands are resting in her lap. Okay, the symptoms are present and roughly equal in both her right and left hands, so symmetric. Her past medical history is significant for schizophrenia, which has been managed for years. 3 months ago, her psychiatrist started her on a low dose of haloperidol for recent episodes of agitation. On examination, you note a resting pill rolling tremor, symmetric bradykinesia, and cogwheel rigidity in both upper extremities. Oh la 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 la. What is the most likely cause of the patient's symptoms? Good question. Option A, Parkinson's disease. No. It's not a Parkinsonism. Next, okay, but it's not a Parkinson. Drug-induced Parkinsonism. Essential tremor. No, it's a drug-induced. It's not essential. Lewy body dementia. My beloveds, we've got a drug-induced Parkinsonism. Okay? So, this is a classic presentation of drug-induced Parkinsonism, actually. The key clues are the offending agent. The patient was recently started on haloperidol, a typical antipsychotic that acts as a potent dopamine D2 receptor antagonist. So, by blocking dopamine receptors in the basal ganglia, it mimics the dopamine deficient state of Parkinson's disease. Next, the timeline. The symptoms, my beloveds, developed subacutely over 3 months, so directly corresponding to the initiation of the new medication, right? Haloperidol. So Parkinson's disease typically had a much more insidious and slow onset over years. Next, yes, symmetry of symptoms. Thanks. Symmetry of symptoms. So the patient's tremor and bradykinesia are described as a symmetric one. So this is a hallmark of drug-induced Parkinsonism. In contrast, idiopathic Parkinson disease classically begins asymmetrically. Idiopathic one, asymmetrically, affecting one side of the body more than the other one, especially in the early stages. Okay, why other options are incorrect? What is A? So the symmetric, the symmetric and subacute onset following the start of known dopamine blocking drug makes idiopathic Parkinson disease less likely. Next, yes, essential tremor is an action tremor, worse with movement like writing or holding a cup. So you take a cup and you start, it's the essential one. So you start with normal, then in a few seconds starts to trem to shake, not a resulting. So essentially, I repeat, it's a very important point. So essential tremor is an action tremor, worse than with movement like writing or holding a cup, not a resting tremor. It also does not cause bradykinesia or rigidity, okay? Yes, lower body dementia, Lewy, while Levy, sorry for my pronunciation, body dementia causes Parkinsonism. It's typically characterized by the early appearance of prominent visual hallucinations and fluctuating, fluctuating cognition, which are not mentioned in our patient's history. Okay, so this is a typically drug-induced Parkinsonism. Actually, very good question. Stay blessed.